One of the best ways to get around in Brisbane is on the City Cab, which is a river ferry, and it runs very frequently, efficiently, and it's a touch-on, touch-off card, same as for other transportation around the town. Hello and welcome to the channel. Over the years, a number of people have asked me what goes on at a medical conference. Well, I'm here in Brisbane at the Brisbane Convention Centre, and I'm going to give you a little bit of a tour of the conference of the Urological Society of Australia and New Zealand. And hopefully you'll get some idea of what happens, and it will help reassure you that the advances in medical care and in surgical care and what goes on at the conferences can really help with ongoing advancement in our field. Now, the first thing you have to do when you get to a conference is to register. Over a 3 or 4 year period, it's necessary for doctors in Australia to keep up with their continuous professional development, and the attendance in conference is one of the things that counts towards that. So it's necessary to attend probably 2 out of every 4 years at a conference. Now, these conferences can be quite expensive. It's often well over $1,000 to register for the conference, and the money is paid before you get here. Clearly, if you don't live in the town where the conference is being held, then you have to get there, and that requires flights, and often it can be around $1,000 or $2,000 to fly to the conference centre and to go home. Furthermore, after that, it's accommodation. So they're not cheap things to attend. Now, during the vlogging, there may be times when I can't show you things. Clearly, there are personal, professional and privacy regulations associated with such an event as this. But I will do my best so you do get some idea. So when you register for a conference, you get a nice little bag of goodies. The first one contains an envelope with the word delegate on the bottom. I'll show you what comes in the bag. So this is what comes in the bag. First of all, there's a pocket program. Then there's a big program handbook. Then after that, there's the invitation to the reception. Another one for more medication. An ad for the conference on prostate cancer in Melbourne. Another medication ad. And an ad for training in robotic surgery at what's now being called the RPA Surgical and Robotic Training Institute. Another one for some innovative solutions for urology from another company. An ad for an instrument that breaks up kidney stones or bladder stones. An ad for a piece of equipment which opens up the prostate area in surgery. An ad for some lubricant which is used for making it easy to pass things into the bladder. Now we've got another one here for more medications for treatment of prostate cancer, and also one for ultrasounds and various equipment, procedure couches, etc. Also, we've got this nice little box which contains a mystery prize, which I'll just open up now. It's not really a prize, it's just an object. And that is, there we go, it's a drinker bottle. So that's what's in the bag. So the programs appear on various screens around the place, and there's always a morning tea time. This part of the conference is where the sponsors bring their products for display and demonstration. So I'll take you for a bit of a stroll around, given that I'm allowed. As you can see, it's really quite extensive and certainly very well set out, and maybe I'll be able to show you some of the things that are displayed. Now, this equipment here is used for robotic surgery. The surgeon sits at this console here, and the robotic instrument is over here where the patient would be on that table. This has got some toys in the Perspex cabinet there that can be manipulated by the operator to give it a bit of a go. Some of the displays are a little more decorative than others, and some of them are a little more prominent than others. Now we're just going to enter the Great Hall at the conference here. This is where the plenary sessions take place. Principally, these are talks given by eminent overseas practitioners who come in and tell us about their latest research and how they and their departments manage various conditions. I may not be able to show you a lot of what goes on in there because of privacy and professional reasons, but nevertheless I'll show you a little.
Still very complex, intriguing and exciting.
In addition to the plenary sessions, there are a lot of smaller sessions on various topics carried out in a more personal atmosphere, which has a capacity of about 50 people for the room. It allows more interaction with the presenter, and question and answers are often very valuable to individual practitioners. The Urological Society is very inclusive, and in addition to the Doctors Association, there is the Australian-New Zealand Urological Nurses Society, which has a program of its own, as well as combining with the doctors for a number of sessions. So this conference is the Urological Society of Australia and New Zealand. Now, what does a urologist do? What is a urologist? A urologist, or urological surgeon, is a specialist surgeon dealing with problems in the genitourinary tract of both males and females. So that is to say, problems with the kidneys, the bladder, in the male the prostate, penis and testicles, and in the female quite often things such as urinary incontinence and recurrent infections. Of course, both sexes can have kidney stones and also various types of cancer. Well, there you have it. That gives you a bit of an idea of what happens at a specialist medical or surgical conference. I hope you've enjoyed it all, and if you would like to have any further information or have any questions or anything like that, just put them in below there, and please subscribe, because I'd like to do a few more in the future, and if you would like a notification, just press on the little bell down below. Cheerio for now.